My name is Malini Mahendra, and I'm an affiliate faculty member at IHPS and an assistant professor in the Division of Pediatric Critical Care Medicine. Pediatric ICUs contribute enormously to improving clinical outcomes for seriously ill children, but also add to the cost of their care. There is evidence that both outcomes and resource utilization, particularly diagnostic study use, vary among institutions. To ensure we get the best outcomes possible while using only the resources required, we need to be able to measure both outcomes and resource utilization accurately. My research focuses on applying advanced analytics such as machine learning, natural language processing, on big data, with particular emphasis on the electronic health record, to improve value-based care in pediatrics. I am particularly interested in studying children with complex chronic illnesses, such as patients with congenital heart disease. Patients with congenital heart disease are at increased risk for cancer compared to the general population. These patients are often exposed to multiple imaging studies, such as CT, nuclear medicine scans, and fluoroscopy studies that require exposure to low-dose ionizing radiation. Population-based studies have shown that patients with congenital heart disease that are exposed to more cardiac caths and CT scans have higher rates of cancer compared to patients with similar cardiac diagnoses. Currently, cumulative radiation doses and calculated increased risk of cancer from medical radiation exposure are not closely monitored or tracked in pediatrics. My current project focuses on understanding which congenital heart disease patients are exposed to high amounts of radiation dose, what studies contribute the most amount of radiation, and the clinical outcomes of these patients. To do this, we merge radiation dose data with electronic health record data and clinical registry data. I also hope to bring research findings back to the bedside and find ways to support real-time clinical decision-making to improve outcomes for pediatric patients. I work closely with the Children's Hospital Informatics teams to analyze hospital data sets and create novel ways of using the EHR to personalize care for patients admitted to the hospital. We are currently working to develop novel dashboards that integrate patient-level, unit-level, and hospital-level data to reduce rates of iatrogenic harm in the hospital.